So, what are signs? What are we looking for? Signs of radiculopathy in the thoracic spine is what? I want you guys to palpate this on each other. We're looking for roping motor bands. Okay.
Thanks.
And she's got some nice ones in here. Right here is pretty good. Yeah. T7. Do you back pain?
This morning, yes.
Yes. Okay. T7 is back nerves. She's doing pretty good at all the other segments. One segment right here, she's got pretty good flickiness going on. So after she gets treated, hopefully that'll go down. And it should. Okay. Then we're going to look for signs of radiculopathy. Can I lower these down here? Good. In her spine. And if I see something I think I want you guys to look at, I'll let you know. This is a tan line. It's not. But sometimes I've had people argue with me, oh, that's a tan line. Well, no, it's not, because here's her tan line. Here's her sign for radiculopathy. Do you see it? Okay.
It doesn't go any lower.
Sorry.
Yeah, right? At least it's not shaped like this. But that wouldn't be a big deal because you're in Florida. We see that every day anyway, right? But you can see this color, this band here.
Okay.
Now, the darker the skin, the darker that band is going to be. But there's definitely a band. Everybody see it?
Yeah.
Okay. The other thing is this. Here we got that kind of deep well going on here. Now, she doesn't have a lot of hair on her body. She's a young lady. However, right around here, there's definitely more hair growth than there is here or here. You see it? Okay. The other thing I'll look for is temperature change. If you can just get the back of your hand and hover down somebody's spine, you can feel points that are warmer or cooler. What I find is that the compression in the spine will usually yield a little bit of warmth, and then where the deficiency is going to be cold. So with her, my guess is going to be L2-3. Do you have neck pain? Yeah, she's got that forward head position. Do you remember we saw that?
Yeah.
Okay. L2-3, look. That's right. We looked at her head. She had the, not so bad thoracic, but she had that forward head position. L2-3, I don't even have to start this. Look, L2-3, L2-3, hair growth, L2-3. Where's the problem?
L2-3.
Okay? So, if we go ahead and use our hands here, and we go like this, go like this, go like this, moving pretty good. Not horrible, but it's definitely there.
May I ask a question?
Sure.
Does this make a difference that your muscle mass is different on one side than the other? Do you also because it's flatter? This one is
Well,
flatter,
yeah,
this one.
and is it the muscle or is it a rotation in the spine? Okay, so it depends on how you look at it. If you palpate, I palpate, she's rotated here. Okay, so she's rotated here. That's going to give you that. And it just depends on what your skills are. But you don't necessarily have to, especially PTs that are into this manual therapy. I mean, they'll evaluate to the fine-tooth comb in the nth degree, right? There's a problem. She's got some problems at L2-3. It's a little bit off balance one side to another. Do we have to explain it scientifically? No. We just know there's a problem there. That's all we need to know. Isolate it, treat it. Don't think too much. Just put your hands on your patients and just treat them. Okay? So finding the inner spaces is the hardest part of all the labs that we do. Okay? And this is where everybody makes the biggest mistakes, so don't worry about it if you get it wrong. She's so jammed up. It's hard sometimes to find these inner spaces. You got the spinous process and the spinous process sometimes overlap each other, and you may not, if it's really jammed up, it's hard to find. So I recommend that you go to the base of the rib cage, bring your finger around and find the inner space between L2 and L3. And it's usually pretty easy to find. You'll feel this process, the inner space, which is the dip, and then a process. And I want you to mark the inner spaces with a dash. Mark the inner spaces with a dash, okay? I just say it twice because last time nobody listened to me, okay? Then we're gonna go, now what I like to do is find L2-3, okay? If you go to the top of the iliac crest and right in, you're gonna find L4-5, good, okay? So So you have L2, 3, and L4, 5. So what do we got in between? L3, 4. So right in the middle is L3, 4. Okay? So it just seems to make it easier. And then you got one above and one below, and you've got your lumbar spine marked. Okay? Come down to the two SI joints right in there. You've got L5, S1. Okay? Okay. Whenever we mark acupuncture points, or I teach you an acupuncture point, there's going to be a landmark, there's going to be fingers, and then there's going to be the point. You never want to cover the landmark with your fingers, and you always want to use the patient's fingers, not yours. So, back shoe points are 2 fingers from the spine. Not from the outside of the spine, from the spine. Patient's 2 fingers. So I'm going to take my fingers and hers, which are the same, and that's what I'm going to use to mark my first back shoe point. There's the spine, 2 fingers, point. Fingers, point. Now, all the back shoe points are directly below each other. The back shoe points stop at L4, L5, right? L5 is 1. Once you get into the sacrum, they're just sacral points. Once you get above T1, they're just spinal points again. But they're actual on the bladder meridian, the inner bladder meridian, 2 fingers out, and they're your back shoe points. And they treat the organ of influence for that level. And it's not too difficult to understand why they would treat the organ of influence at that level. Because right where it truncates up and out, then it splits into 2. So if you've got nerve compression, obviously, you're going to not only lack energy to the tissues, but also to the organs of influence. Okay, so this is the first part of your lab. Now, if I go into the sacrum, I'm going to palpate for, this first sacral vertebrae, but you don't have the back shoe points, but there's foramen in there. So you're going to kind of palpate for those little openings where the nerves come out. And the further down you go, the more in they go. And you can get all the way down into here if you need to with the patient and get down into the sacrum. Okay? Okay. Trigger point. Okay? In your book it says it's the piriformis. Okay? But it's really, a Bruceism would be the piriformis-ish. Okay? It's the upper outer quad. You want to find glute. The upper outer glute. I usually don't do that till day 2. I need more coffee. Coffee. No, I won't do more coffee. Upper outer gluteal. Okay, so is there an acupuncture point there? Well, there is an acupuncture point there, but that's not what we're looking for. We're looking for the Achi point, or the tender point, or the trigger point, the most tender, ropey, tight point we can find. What did we just do? We balance out the gate. Now we want to find that trigger point, treat it, circuit it with some gallbladder points, influential point for soft tissue, and just release it so that manual release that we did will hold when that person starts to move around. So, if I just, with my hands, cut it into quarters, go in the upper outer glutes, keep saying quad. Ooh, when their head pops up, that's the spot. 2 fingers, superior and medial is about where we're looking for from the trochanter. Okay, so if I go to the trochanter and I go 2 fingers up and then 2 fingers in, it's right there, and yeah, that's it. See? Thank you for that demonstration. Mark it next. Okay, it's not going to necessarily be exactly the same spot on both sides, so I just have a tendency to just palpate out there, and boom. X marks the spot. It's not an acupuncture point, it's a trigger point. Okay, all this stuff is in your book, guys. All right. Now, I'm going to have her put her hands down at her sides, both hands, and you're going to rest your hands right onto your legs. Now, we're going to palpate for the IT band. All right, IT band. It's about inch and a half wide. It's a real tight fascia. Okay, you don't have it. Runners will jump out at you. Right in the center of the IT band, at the tip of the main ray, the middle finger. Tender. That's gallbladder 31.